This is your host, Helen Thompson. Thank you for being here today. If you are already subscribed to the show, thank you so much, mums. You always are amazing, and if you are here for the first time, make sure you subscribe to the show. Google Podcasts will shortly be closing permanently, so if you subscribe via Google, please subscribe via another platform so you don't miss out on each episode. You will find First Time Mums Chat on all the main platforms, including Apple Podcasts, Spotify, Amazon, as well as now on YouTube. Today, like in every episode, I am bringing you an amazing woman, Dr. Emily Gornata, who is a licensed clinical psychologist specializing in maternal mental health. Dr. Emily is launching a US-based online practice that aims to reduce the barriers that mums often face when looking for support and therapy in areas including postpartum anxiety or depression. During our chat, you'll hear us talk about the challenges of returning to work after maternity leave, which is sadly often a hard time of readjustment for mums. If you're a new mum, or if you're about to commence your parenting journey, then you'll know that many women in our modern fast-paced world feel alone and unsupported. Many are isolated and lack support from members of their family, such as their mothers or other close feminine role models. I'm your host, Helen Thompson, and I'm a childcare educator and baby massage instructor with many years' experience working with families. I started the First Time Mums Chat podcast in 2021 to help support mums as they face the challenges and struggles that parenting often involves, particularly when getting started for the first time. To help ease your transition into parenthood, I aim to offer supportive, holistic approaches and insights for mums of babies aged mainly from 4 weeks to 10 months old. In each episode, you'll hear insights from experts and other mums to help you become the most confident parent you can. Let's do this together. This podcast is for informational purposes only and does not constitute medical advice. Please contact a medical practitioner if you are concerned or have any medical issues. Let's meet Dr. Emily and get on to the interview. Hi, Dr. Emily, and welcome to First Time Mums Chat. I'm delighted to have you here, and I can't wait to chat about the challenges of returning to work after maternity leave and to hear all about your new venture.
Thank you so much, Helen. Yes, my name is Dr. Emily Gornata, and I'm a psychologist, and I also own Phoenix Health, which is a maternal mental health practice where we support new mothers that are dealing with a lot of the challenges of new motherhood. So Phoenix Health came out of a need for, I realized when I was working as a psychologist that there just weren't enough practices that specialized in serving mothers. I truly believe that mothers deal with unique issues that it's challenging for them to go to a more general practice, a more general therapist, because everything that they're going through, especially during the postpartum period, is really unique. They really need someone who can understand what that period brings and what that's like. So my business partner and I developed Phoenix Health. So we're an online practice. So we make it really easy for mothers to get therapy. And we're based in the United States. We're serving New York. And our hope is that down the road, we can also serve mothers in other states as well.
It sounds like a fantastic opportunity for mums who need that extra support. I know that it's quite a trauma to get help when you're a first-time mum with a baby.
That's kind of been the experience that I've heard as well, that a lot of mothers find it hard to find a provider that specializes in this area, and then to make it a priority to take the time and really put their mental health first is really difficult. So we want to really reduce as many barriers to moms getting help as we can. And that's our mission at Phoenix Health.
I think that's a wonderful idea. You hear a lot about trauma. Everybody talks about the birth trauma, but what I really wanted to focus on with you is the trauma of when you go back to work as a mum. How did you feel when that happened to you, when you had to go back to work when your baby was so young?
Well, it's definitely something that I personally didn't feel really prepared to do so early on. And I know when you and I had originally spoken, we had talked a little bit about how it's a bit different in Australia. compared to the United States. In the United States, there's a lot of pressure to go back to work really soon. And a lot of mothers here feel like they don't really have a choice. So
Mm.
their employer might give them, if they're lucky, 3 months off, but sometimes it's far less than that, or they're having to take unpaid leave and it's a big burden financially for their families. So the consensus that I hear among mothers is that they feel like they're being kind of pushed back to work much sooner than they feel ready. And this has actually even been referred to as the fifth trimester. So, you know how we kind of talk about the fourth trimester as being that first 3 months of the baby's life. And then you get to that point, and then we call the fifth trimester that transition back to work. And it's its own unique trimester with its own stresses. It's just a very it's a very different experience. I personally did feel that when I had both my children and I had to return back to work, that I felt like it was a new transition. I kind of felt like I was back on my first day of the job again. It felt like almost starting a new job after taking some time off and becoming a mother. That's another thing that I hear a lot of mothers share is that they feel like they're going back to work and they think that they're just going to pick up where they left off, but it really does feel like they're starting over again.
And how were you supported? Were you supported by your colleagues when you went back to work after having your baby? If you needed to breastfeed or leave to go at lunchtime to feed your baby or whatever you needed to do?
I personally did have a really good experience because I did have colleagues that were mothers or fathers themselves. And I think part of the benefit also of being a mental health professional and working around other mental health professionals is that they're really in tune to that. I know a lot of the clients that I've worked with, or even family or friends who have gone back to work after having a baby, share that they're not so fortunate and that they feel like sometimes their colleagues don't understand or are pressuring them to do things that maybe they're not comfortable with if they want to schedule in breaks to breastfeed or pump, that legally their companies can't tell them not to do that, but there might be kind of this company culture or pressure to just jump right back into work and be really productive. So a lot of people have different experiences, and it's really hard for mothers that are going back to a company that isn't so supportive.
What sort of advice would you give to a mum who was going through that trauma and doesn't have the support from their colleagues?
The number one thing that I always tell moms when they're preparing to go back to work is to understand that it is going to be a transition. So, to have really realistic expectations for themselves, I tell them don't expect to go back the first day and feel like yourself, and don't push
Mm.
yourself too hard, too fast. Give yourself time to acclimate back. And even if you're feeling that pressure from your boss or your colleagues, you need to take a step back and tell yourself, I'm going to take this time because I know I've been through a lot, and to put that into place for themselves, even if they're getting that pressure from other people. I also think it's very important to know your legal rights wherever you live. So here in the US, we have state laws around requiring mothers who are breastfeeding to have time to pump at work, and just really educate yourself on what your rights are. So if your company is giving you a hard time about that, you know legally what you're entitled to.
You've got a much vaster state system than we do. But are you saying that each state has a different law?
Each state does have slightly different laws around pumping, around being entitled to breaks to pump breast milk during work hours. It can vary from state to state. Generally, most states do allow some sort of break system. For example, when I was going back to work, I was living in New York and we were entitled to have breaks scheduled throughout our day. I was very fortunate, like I mentioned, that I had a really very supportive workplace environment. So I didn't have to really stress too much about it because whatever I needed, my colleagues were wonderful about providing for me. For moms who don't have such great support at work, it is important just to know legally what your rights are in your state in case your employer is giving you a hard time about taking those pumping breaks or whatever it may be.
Yeah, as you mentioned in the beginning, Phoenix Health actually supports mums and helps them to go back to work. So, how does Phoenix Health help mums?
Yeah, that's a great question. So, we're a therapy practice. So, we have therapists who are licensed and specialized in helping moms who are trained in how to treat moms that are dealing with different mental health concerns. And we do online telehealth sessions. So, the beauty of Phoenix Health is that you can go onto our website, you can get matched with a therapist, and then you can actually attend your therapy sessions online. So it is actually really convenient for moms who are planning on going back to work or who are already back at work because it makes it a little bit easier to schedule your therapy sessions since you could do them during your lunch break or in the evening after your baby goes to bed. You don't have to worry about driving to a therapist's office and
Mm.
sitting there for an appointment. So that's something that I've gotten a lot of feedback from clients on that it's really important that therapy can fit into their busy lifestyle as a mom, or else it just doesn't become a priority. So that's why we really aim to reduce as many barriers for moms as possible so that those moms who want the support, who need therapy, who want therapy can get it as easily as possible.
And what kind of therapy is that? Do you have different kinds of therapy that mums can get?
That's actually another great question. So the types of therapy that we offer, we tailor to the specific client. So there are certain things that some clients might be dealing with that might respond better to certain types of therapy. For example, if a mom is coming in with really bad anxiety, we're probably going to do a type of therapy called cognitive behavioral therapy because the research has showed that that's really effective at helping moms manage anxiety. And that really focuses on a person's thoughts and changing negative thoughts that are causing the
Mhm.
anxiety. But for example, if a mom is dealing with something like obsessive compulsive disorder, which can arise during the postpartum period, moms are actually quite vulnerable to developing OCD. We would do a type of therapy called exposure and response prevention. That's simply because that type of therapy has been shown in the research to be most effective for treating OCD. So we really tailor the type of therapy that we use to what each of our clients needs.
And that relates to postpartum depression, as you mentioned, anxiety. A lot of mums go through postpartum depression. And it also could be anxiety, as we've mentioned, about going back to work, or anxiety about not being able to touch their baby, or anxiety about not being able to sleep or not being able to rest and running around, excuse this is an Australian expression, but running around like a headless chook, not being able to do anything because you're so focused on your baby that you're not taking that time for yourself. And so that can produce anxiety.
Absolutely. Yeah, absolutely. And I find that a lot of people use the term postpartum depression. They'll come into therapy and they'll say, I think I have postpartum depression. But what a lot of people don't realize is there are actually a lot of different conditions that are kind of subtypes under postpartum depression. So, like you mentioned, there's postpartum anxiety, there's OCD, which some women can develop after having a baby. There's the birth trauma that can lead to PTSD. So there's all these specific conditions that it's hard for a person who hasn't gone to school for this or isn't knowledgeable in this to identify. So when you come to us and you get assessed by a psychologist or by a therapist, we'll be able to tell what specific condition you have. And then that'll tell us what type of treatment we can offer you or what type of therapy is going to work best for that specific condition. So that's why I always tell people if you're suspecting that something's not quite right, if you're really not feeling like yourself after about a month or so postpartum, don't hesitate to reach out for help because there's really no reason to kind of wait and see if it gets worse when
Mhm.
the help is out there. Even if you just need a couple sessions to get your bearings again and feel a little bit better, it's so much easier to come in for a couple sessions and work on things versus letting things fester and then having them get worse and everything kind of piles on top of each other. There's really no reason to do that or put yourself through that.
Do you support the dad as well? Can it be a group session with dad as well as mum, or is it solely just for mums?
We really tailor it to what each of our clients needs. So there's a lot of cases where we find it helpful to bring the father or the partners into sessions too, especially if the couple is having trouble communicating with each other
Mhm.
or the father is concerned about what his spouse is going through and doesn't quite understand it. We can help him understand what's going on and teach him some ways to communicate better with her and support her. So we definitely do encourage fathers or partners to be involved in the therapy as well.
I think that's a good thing because it takes two to have a baby. So I think the fathers sometimes feel stressed as well. And they feel if mum's breastfeeding,
they don't have the connection with the baby.
Absolutely. I've heard a lot of fathers and partners express that as well, that they feel like they don't know how to be a support to the family or they don't know what to do. So giving them a task that can help facilitate bonding, I think is a great way to have fathers feel more involved and to start developing their confidence as a dad as well. Studies do show that fathers or non-birthing partners or even adopted parents can also experience postpartum depression.
Mm.
Often it can look a little bit different. For example, fathers are actually more likely to experience more anger in their depression or more irritability. The researchers estimate that about 1 in 10 dads do show signs of postpartum depression. So it definitely doesn't only affect mothers.
Yeah, it's interesting how you said just then, if you're an adoptive parent, that you haven't actually gone through the birth yourself and you've adopted. I'd never thought of postpartum depression with an adoptive parent before because I sort of figured that if you've adopted a child, you haven't gone through all that trauma. So it's more of an excitement. But then I guess it changes your life as well. That's a very interesting point you just brought up.
It really shows that we think of postpartum depression as being hormonal, or hormones play a big role,
Mm.
and they definitely do play a very large role. But the fact that we do see postpartum depression among dads, non-birthing partners, adopted parents, it shows us that it's more than just the hormones. It's the whole stress of the transition. It's taking care of a newborn, which is very demanding. It's the lack of sleep. It's so many things that all come together, and any parent is really vulnerable to possibly experiencing postpartum depression.
So is there anything that we haven't mentioned that you'd like to add?
I think just the thing that I want to emphasize again with mothers going back to work is really for moms to remember that it is a transition. I think so often we just want to jump back into things. We want quick fixes. We want to go back to
Mhm.
work and just on day one feel like ourselves again. And we really have to understand that it is going to take time to acclimate back, that when you go back to work after having a baby, you're in some ways you feel like you're a new person. You're going back as this person who is changed. And just
Mm.
to have grace for yourself and manage your expectations and do what's best for you. You might feel pressure from colleagues or from your employer to jump right back in and be as productive or better than you were before. But we really have to be our own advocates and we have to know our own limits and go at the speed and the pace that feels right for us. So I just want to re-emphasize that to listeners that it is a journey.
Yeah, especially when you've just given birth and you have to go back after 6 weeks. That can be a trauma in itself, leaving your little baby behind and having to go through who's looking after the baby. I can't get into childcare if I don't have a grandmother or anybody to help look after the baby. As you said, it's a stress in itself. So that makes it even harder. And not having a supportive place would make it harder
Absolutely.
again.
Yeah.
So if anybody wants to get in touch with Phoenix Health, how would they go about doing that? I find what you said really interesting. Although I come from Australia, most of the people who listen are in America.
They could reach us at our website, which is www.joinphoenixhealth.com. And we're also on Facebook, Instagram, and LinkedIn. So if you search for us, you should be able to find us in any of those places. Because of licensing laws in the United States, we can only serve clients that live in the states that our business is able to serve right now. But our hope is really to be able to serve more states in the near future. So we're working very hard on that to branch out to other states so we can support more moms. But if you do live in another state and you're in need of mental health services and you're having trouble finding a provider, I would highly recommend you go to Postpartum Support International, which is an international organization that offers a directory of providers. You can actually search for therapists in your area, and all the therapists specialize in working with new moms. And you can find them at postpartum.net. That's their website.
Well, thank you, Dr. Emily, for being here. Just before you go, what's a tip you would give to a mum who's struggling with having a baby?
Don't be afraid to reach out for help. So often moms will say, I'll just give it a little bit more time. I'll wait and see. I'm sure it'll get better. And they kick the can down the road. But there's really no reason to put it off. If you feel like something's not quite right, you're not feeling good, please reach out for help because there are people out there that want to help you and you deserve it.
If you're looking for further support and guidance in your return to work after maternity leave,
then I highly recommend checking out an interview I did with Millie Che, author of Merging Parenthood and Work. I've included a link to the episode in the show notes. Thanks, mums. You're amazing, and I hope you enjoyed this episode. I would love to hear from you and let me know what topics are of interest to you. If you haven't done so already, make sure you hit the subscribe button, because in the next episode, I'm chatting with birth healing specialist and pelvic health physical therapist Lynn Schultz about her approach to helping women with issues they experience after birth. The other thing I want you to do after listening to this episode is to get your Sleep Tips Quick Start Guide to help you establish a sleep routine that works and helps you feel less tired, less stressed, and have a happier, more contented little one who sleeps better. To get yours, visit mybabymassage.net/sleep now. That's mybabymassage.net/sleep now.